Hello and welcome everybody. Hello relatives. I hope you are all doing well. Welcome to our celebration to honor our clinic partners who have participated in our National Comprehensive Cancer Control Programming and National Breast and Cervical Early Detection Program. Thank you for all of you for joining us across Indian country. My name is Melissa Buffalo. I'm an enrolled member of the Meskwaki Nation in Iowa. I'm also Dakota from the Crow Creek and Lower Brule Sioux tribes. I am a mother of two. I am the Chief Executive Officer with the American Indian Cancer Foundation. And today I'm joined by Lindsay Petrus, Cancer Programs Manager, Misha LaPlante, and Kate Key. We are here today to honor and thank our amazing partners for their excellence in providing preventative cancer services to their communities by grounding themselves in culture and utilizing evidence-based interventions to support and change the landscape of cancer in Indian country. American Indians and Alaska Natives American Indian Alaska Native people have much higher rates of getting several cancers, including lung, colorectal, liver, stomach, kidney cancers, compared to non-Hispanic white people in the United States. The work we have done in the last 5 years with this funding has been centered around the urban Indian health organizations, having the wonderful privilege to connect and support 41 urban clinics. Many of my staff and I come into this work not only through a professional dedication to improving the cancer rates for our relatives, but also by personal experience in the way cancer has impacted our families. Again, I welcome you all, and I will hand it over to Lindsay quickly.
Yes, good afternoon. Thank you all for being here. So there are a number of ways to reduce the incidence of cancer. The first I'd like to mention is cancer screenings. These screenings, such as mammograms, Pap tests, and colorectal tests, can detect cancers earlier when cancer is more treatable. Next, knowing your family history will help the way you and your healthcare provider decide on screening options that are right for you. Other preventative ways to support a healthy body are increasing the amount you exercise, eating a well-balanced diet, eliminating the use of commercial tobacco, limiting alcohol use, getting vaccinated, and protecting yourself from the sun, and also visiting your doctor regularly. I would now like to invite our CEO, Melissa Buffalo, to share a prayer.
Thank you, Lindsay. I'm back. I am going to burn some sage and sweetgrass before I get started with a quick prayer. And I have a lighter that makes it sound like it's like this big torch, so forgive me. Again, thank you for allowing me to start all of us off in a very wonderful way. Creator, Great Spirit, Grandfather, I greet you on this day with so many thanks for all of the blessings of our lives and our connection to one another in this space, the connection to the land, the connection to our ancestors. Creator, I thank you for all the blessings of knowledge, of breath, of kinship, and most importantly, love in this space that we are all together today. Creator, I ask you to guide us in our work, guide us to be good neighbors, to be good relatives, to guide us in a good and grounded way for this work for our relatives that is always going to be continuing. Creator, again, Wopila Pilamia, for this day, for this moment, I ask that you continue to watch over all of us as you have, lead us in that good way. Le ampetuki washte, Wopila, this will be a good day. Thank you.
Thank you very much, Melissa. That was a beautiful way to start us off. I really appreciate that. So today we are honoring the American Indian Health Service of Chicago Incorporated, Native American Community Clinic, Oklahoma City Indian Clinic, Urban Indian Center of Salt Lake, and the Urban Intertribal Center of Texas. I'd like to introduce Misha LaPlante, Cancer Programs Project Manager, and Keiki Bergy, Cancer Program Coordinator, who have played an integral part in supporting and uplifting the amazing work our partnered clinics have accomplished. Both Misha and Keiki have collaborated with each clinic to build implementation plans that fit the community's unique needs, while also balancing and overlapping a real concern of COVID-19. The AICAF team would also like to recognize and uplift our partnerships with the Urban Indian Health Institute, National Council of Urban Indian Health, and our medical consultant, Dr. Briegel, and the Centers of Disease Control and Prevention. Through these collaborative and dynamic partnerships, we have begun to move the needle on cancer issues in Indian country.
Buju, hello everyone. I am so excited to introduce the first clinic that we'll be discussing today. So the American Indian Health Services Center of Chicago was incorporated in the state of Illinois in Chicago in 1974. The organization's mission is dedicated to providing quality healthcare to the American Indian community and other underserved, under-resourced populations. As such, the organization provides accessible preventative healthcare and outreach services regardless of one's inability to pay. The organization is one of 34 urban Indian health centers for American Indians in the United States, while also recognizing there are other referral sites, referral clinics across Indian country, as well as the board of directors, who consist of 11-member community-based volunteers, of which 51% are Native. And then also want to mention that the American Indian Health Services of Chicago has collaborated on increasing the percentage of Native adults who are up to date on USPSTF recommended colorectal cancer screening from 21.6% to 25% above the baseline from July 2021 to June 2022. The American Indian Health Services of Chicago has been an advocate and contributor to celebrating Blue Beads Month, an awareness campaign focusing on colorectal cancer screening.
Good afternoon, everyone. I'm happy to introduce the second clinic for today, the Native American Community Clinic. Opened its door in 2003 to address the health disparities within the urban Native American community of the Twin Cities in Minnesota. The mission is to promote the health and wellness of mind, body, and spirit of Native American families. They offer a full range of healthcare services that include medical, behavioral health, dental, and substance abuse programs. Native American Community Clinic approaches healthcare by addressing root causes of health disparities, including access to food, housing, and health insurance, with services such as resource navigation, care coordination, outreach, and community-based activities through the use of their peer recovery coaches and community health workers. American Indian Cancer Foundation and Native American Community Clinic have collaborated to work on evidence-based interventions for cervical cancer screening. I would like to introduce Moriah Johnson and Michael Sampson, who have a definite role in the successes of this partnership. They're responsible in performing various health system change efforts, such as implementing frequent mobile mammogram events to increase the screening numbers, connecting with the community and understanding their needs to improve access to transportation, which resulted in increased cervical cancer screening rates. The clinic also hosted various cervical cancer screening events supported by the American Indian Cancer Foundation and delivered sincere efforts to reduce structural barriers by participating in various awareness campaigns focusing on cervical cancer, distributed appropriate small media resources and swag items within their community to acknowledge the community's efforts towards cancer screening. They're always looking for unique ways to enhance cervical cancer services for their patients to improve access and address the social stigma associated to cervical cancer. I would like to congratulate them for passionately looking after their community's needs. Now, I would like to introduce the third clinic for today, the Oklahoma City Indian Clinic, which is a 501c3 nonprofit corporation that strives to increase access to quality healthcare and wellness services and produce positive healthcare outcomes for urban American Indians living in the central Oklahoma. Oklahoma City Indian Clinic is a contractor of the Indian Health Service to provide culturally sensitive health and wellness service from talented and devoted providers. From pediatric and prenatal care to family medicine, the clinic services not only include basic medical care, but also dental, optometry, behavioral health services, fitness, nutrition, and other family programs. The vision is to be a national model for American Indian healthcare with the mission to provide excellent healthcare to American Indians. Both American Indian Cancer Foundation and the Oklahoma City Indian Clinic have partnered to work on the evidence-based interventions for breast and cervical cancer screening. With Katie Croy, Jessica Deaton, Dayton, and Madison's continuous efforts towards this partnership resulted in developing various small media resources to create awareness about abnormal pap test and colposcopy, availability of HPV vaccination for older adults, and what to expect at mammogram breast tear-off resources apart from strenuously working towards reducing structural barriers for their community. They have shown a sincere participation in American Indian Cancer Foundation's breast and cervical cancer awareness campaigns and coalition meetings. Being said that, Dr. Freeman from the Oklahoma City Indian Clinic presented a webinar on a wonderful topic of what to expect at your mammogram for the AICAF's breast cancer awareness campaign last October. During the cervical cancer awareness campaign this January, they successfully created a yarn wreath with different types of turquoise threads to be tied on by their patients who complete their PAPs during the month, and then added on white threads to represent how many abnormal PAPs were amongst those that were completed. They also displayed the tribes of the patients that got screened that month to create a tribal competition. Would like to congratulate Oklahoma City Indian Clinic for their sincere and continuous efforts for their communities. Would like to look at Jessica, Katie, and Madison, if they would like to add something.
I just want to say thank you guys for working with us over this time frame. It's been a great experience.
Yeah, just thank you for allowing us to work with you guys and all of your support.
Yes, I just want to thank you all for all your support and insight and help with us through the process of this year and the previous years. Thank you.
Well, thank you both. So I'm going to move on to two of our other wonderful partners, including the Urban Indian Center of Salt Lake City. They are located 2 miles from downtown Salt Lake City. Because of their unique physical placement, they're able to serve the Utah tribal populations of the Ute, Paiute, Goshute, Dene, Shoshone, and Arapaho, Oglala, Lakota, Cheyenne River, Wind River, Shoshone, Cherokee, and the Rosebud Lakota from neighboring states. AICAF and the Urban Indian Center of Salt Lake City have collaborated to work on increasing the percentage of American Indian Alaska Native patients who are up to date on those recommended screenings for colorectal cancer from 10 screening tests to 20 above the baseline between July 2021 to June 2022. The Urban Indian Center of Salt Lake City has implemented several colorectal cancer awareness events within their community. They're not here today due to prior commitments, as well as our following clinic member, the Urban Intertribal Center of Texas, who is a nonprofit organization with a successful 46-year history of providing culturally sensitive, community-based services to meet the diverse needs of over 76,000 American Indian Alaska Natives living in the Dallas-Fort Worth Metroplex. Not a word you see every day. The American Indian Cancer Foundation and Texas have collaborated to increase the percent of Native adults who have decided to quit commercial tobacco from 17.8% to 30% above the baseline. Through our partnership, we have created several smoking cessation policies for non-traditional and commercial tobacco products. And as I had mentioned, there are a few clinic partners that are not here today due to many different priorities that they had. And we just want to acknowledge that we are so thankful for their presence in this space, despite maybe not having the opportunity to speak with them directly. But we are certainly celebrating and honoring all of the work that they do, and might have an opportunity to talk about it here in a little bit.
Great, thank you, Misha. And thank you, Keiki. It has been a great honor and privilege to work with each partner. As you can see from what Misha and Keiki have described, there's been some amazing work that's been done. And AICAF truly appreciates your continued efforts in reducing the cancer burden throughout Indian country. So now we're going to move into the question and answer portion of the event. And so I would really like to welcome our partner, Oklahoma, that was able to be here today to share some of their wisdom in this facilitated discussion. So I'm going to pass it over to Misha and Keiki, and I welcome you to start discussing.
Hello all. So the first question that I have is, what were some things you were able to do differently by participating in this project?
I'm sorry, can you repeat the question?
Yes. So what were some things that you were able to do differently by participating in this project?
I think it allowed us to, or allowed me to see what other clinics were doing that was successful for them so that we could adopt some of their success models instead of trying to figure it out on our own. And then utilizing that into what we had already built to increase our screening rate and increase knowledge in our community.
Jessica, you sounded a little far away there at the end. I'm really interested to learn a little bit more. Maybe you can share with people that are listening in about Turquoise Thursday. You had some really neat ideas. Where did that come from, and how did that come about?
So we did a few different things for Turquoise Thursday this year. We did a way for patients when they checked out from their appointment so that they could write their tribe down to show that they had representation of their tribe. I actually got part of that idea from Nisha's postcard she had sent out for that with representing your tribe and representing your body. And so I kind of used that along with some ideas from Dr. Freeman, where he wanted us to make sure we were really acknowledging the tribes that were being seen within the clinic. So I thought that would be a good idea to really showcase the tribes that were utilizing us, and especially for screening. And then we did the kind of the yarn, I don't remember what we ended up calling that, but we did the turquoise ribbons and yarn to show the PEPs that were completed during the month of January, and then the white yarn to show all the abnormals that came back. It was a good visual for our patients. We have it hanging at the front desk, and that way when they are coming in to make appointments or check out, they can really see that visual of how many abnormals we actually get each month and how important it is to complete their PAPs and carry on with that screening process. A lot of my ideas are really just searching like Pinterest and Google and trying to find something that is maybe out of the box that will grab attention, and then adopting it to how we can make it work for our clinic.
Great, that's really helpful. I think, you said something earlier on is just what are, you were talking about learning from other clinics, what are some of those really important pieces you took away from other clinics as you were doing this work?
Put me on the spot, Lindsay. I think they had a lot of more cultural resources because a lot of the other clinics, I feel like, work more directly with certain tribes, where we work with all the different tribes. So being able to really see how we can incorporate the tribes we do work with and see into the messaging that we're putting out. And I think that that's something that we hadn't been able to really focus on before, especially in our cancer screening realm. And that was helpful to be able to kind of add that in when we're targeting our patients and bring that cultural aspect back into their care.
I think it's interesting when you're talking about how many different tribes you work with. I can't remember off the top of my head, but I remember you guys talking about a number of them. And something that Oklahoma did really neat is they actually created a resource with, I can't remember the word, Katie or Jessica, you might remember, but it was actually a border. We created a border with representation, which was really important. And so I don't know if you guys want to talk a little bit about that resource.
Yeah, so we worked with you guys to create that for PAP results. Our old PAP result forms were just not, the education was correct, but it wasn't very patient friendly. And so we gathered, I used resources within the clinic to identify the tribal words for women or woman. And we utilized that on the outline of the paper. And then that represents, well, within that letter, sorry, it has different information about their PAP results and how to know what the PAP results mean. And then on the back side, it has information about what to do with the neocolposcopy, what the prep is, and what to expect. And it really provides that extra education for our patients that want that in their hand and want to review it.
I think that's really amazing. And I love that you guys took a resource you already had and you really customized it to the community. And so I'm really interested, Madison, Katie, and Jessica, what have the reactions been since you've been working with AICAF with some of those different resources from the community? Have you had any feedback from the community members? Do you feel like community members are more apt to get some of those screenings or even to start discussing some screenings?
I think all the resources that have been provided through you all, also like with mine in particular, it was Check Your Juju Shaman. I placed those at the event in October. So it also has that cultural aspect in conjunction to that. And then we did also provide other resources through you all. We did have a really high rate on returns in regards to mammograms, especially in the month of October, breast cancer awareness. I felt like I did not hear any personal, I guess you say, testament from a patient per se, but with the return rate, I felt like that was, enough in itself. The statistics behind it, we've seen a lot more patients with that material.
Yeah, I'll piggyback off of that. We went ahead and sent out postcards with kind of the same thing that Jessica talked about for colorectal cancer screening. And I do think that those reminders really reached the patient and helped improve those rates. But I don't have, I guess, personal comments from patients per se.
Well, we know those client reminders are definitely one of the CDC evidence-based interventions that they like for us to discuss. So we're really happy to hear that implementing that strategy is working in our communities. I just spoke with another clinic today, and they said something really similar actually with the client reminders that they're doing. So it's really exciting to see that kind of consistent outreach is really helpful. And I know for myself personally, having that reminder, even from Lindsay sometimes about different projects we do, for instance, is extremely helpful. So really thankful to you all to continue to do that, because I know it's not always easy, since you might have so many different applications that you have to use, different ways of pulling the information, that kind of thing. It just can be certainly a lot and very time consuming. So thank you for those efforts. So I guess kind of related to making resources culturally relevant, we know sometimes it's really important to make resources more relevant to cancer survivors. So we're curious if at all, were there ways that after participating in this project, or because of participating in this project, that your clinic has approached cancer survivorship differently? Or are there ways that you're going to be kind of expanding maybe your cancer survivorship efforts?
With things now starting to open more at the clinic, I think that would be great to start having more of the survivorship, or nonetheless, maybe start up a virtual group for those that are still concerned. But I think that would be amazing to do that. And then we did have one patient that was a survivor do a video for us, and we posted that on social media during the month of October. And so that way, patients, you know, although that is a very stressful process and scary process, that attachment from a patient and so forth, I think that can make a big impact in the level of care and what level of care that we can provide here at Oklahoma City Indian Clinic. But in regards to survivorship, I would like to look into that, where we might could do virtual meetings and make those arrangements in the future.
And I'll piggyback off of that with cancer screening for colorectal cancer. I think that reaching out to some of our survivors and having them provide a video for others who may be in that age bracket that need to get screening would really encourage those patients who are a little bit weary about the testing to go ahead and, you know, get screened. So I think that's how we will move forward from here.
Really excited and very happy to hear that. I'm sure all of us are very well aware, but oral storytelling, having those survivor stories is so important because it is traditional for us to have the opportunity to hear from our other relatives. And so it's just really wonderful that AICAF as well as Oklahoma City Indian Clinic can provide a space for our relatives to hear from cancer survivors, caregivers, and other relatives who are impacted by that diagnosis. And as you mentioned, it is extremely profound when you hear from a relative who has that diagnosis and or experience with cancer screening. I'm gonna check in with Keiki and see if there's any questions that you wanted to elaborate on.
Yeah, I'm grateful to hear all those services that the Oklahoma City Indian Clinic is providing to their community. But in addition, also wanted to know that how is the AICAF's Cancer Coalition impacted your role in the community, or how has the coalition helped you to gain any new insights from your participation with the coalition?
Okay. Yes. You guys have did a tremendous job in helping with us, and of course providing insight, education, as well. Kadaki, we were working on the tear off resources as well. Of course, it'll look different than this. That is great and wonderful. That way the patient knows what to expect at a mammogram. And I greatly appreciated the insight and overview of that to make suggestions on that tear off sheet where needed. So I'm excited to start sharing that with our patients so there's less hesitancy. And then that way we can get them in hopefully more frequently without being so nervous about that. And then also too, it's this, of course, don't do justice, but it's some of the artwork that your team has provided to us. And I thank you guys for that. It's beautiful. We get all kinds of compliments on that. And I am planning on displaying that again this year for the month of October in regards to reminding our patients, in regards to those important screenings and providing that literature and so forth. So, and then in conjunction to that, I also, with your partnerships, making postcards, and this is something that we are currently having our community development to work on, in opposed to just sending out a letter. So that way, hopefully that is a little bit more eye-catching. I'm sorry, I don't know if you can see it very well. A little bit more eye-catching for our patients. And of course, we appreciate all the contributes that you guys have made.
Yeah, I just want to thank you guys for all your support and encouragement and all the resources that you've provided, and just brainstorming ways to help our patients get screened, tracking the data so that we know if it's working, things like that. We really appreciate it.
For me, I think that the coalition meetings have been beneficial to brainstorm with everybody and different clinics and even different screening modalities. What's working for maybe breast cancer or cervical cancer, or I'm sorry, colorectal cancer, ways that we might be able to modify that to apply it to cervical cancer or make those changes so that we can have success with all of the screenings that we're doing. I think the coalitions has also been helpful in really focusing on the evidence-based care models and being able to see how we can pull that into what we're trying to accomplish and how we approach our patients.
I'm going to jump in because you brought up a good little light bulb in my head. As we think about evidence-based interventions, and we've talked about a multitude of different things you guys have done, what has been like the best response community, best response clinic-wide? What has worked the best for you guys? Do you mind sharing some of that?
I think for me, it's been something Katie had mentioned, the postcards. We did that. I think it's been about 6 or 9 months ago. And I think it's been helpful. We have the postcard for the reminder and then a postcard that's very generic on the back side that just says your results were normal. It doesn't say what the results were. And it says, thank you for your visit. We enjoyed taking care of you. Please come back and see us again. And then I check mark either 3 years or 5 years. And then give us a call if you have any further questions. And so I think that is a way that we are letting the patients know their results are normal. They're getting that follow-up on their results. They're not having to wonder what their results were. And we're also, sending that reminder back in a few years. So they're going to be able to identify that postcard with needing to get screened. And we've had multiple patients call our scheduler and say, I got a postcard in the mail. And so I think that has been really helpful on getting patients in the door.
So patient reminders have really worked, especially for PAP screenings. So
yeah,
that's amazing. I'm wondering for CRC and for breast, what that experience has been like and what's worked best for you.
Yeah, I think we've had pretty much the same success with CRC. I think the patients respond well to that, knowing that they get that follow-up, because, with a negative screen, that being normal, sometimes those don't get called quite as much as if they had a positive screen and need to be have a colonoscopy or something further. So having those normal results sent to the patient so that they have that follow-up, they know that when they should expect that they should hear from us again, or they need to reach out to us to get scheduled again. So.
Yes, and then in regards to mammograms, again, the small media, the cultural aspect as well in conjunction to that, especially during the month of October, those patients grabbing those resources and materials. When I was up and setting up that materials and so forth, I could tell like some patients, they did not know, a lot of those things. So those educational resources will make a big impact. That way they can also not necessarily get a screening just for them, but they can also relay that to their relatives. And then that way that will promote even more screenings. And then in regards to the postcards, that is something that I will be implementing soon. And so I can't wait to see the return on that. That will be very exciting.
These are all great. And so I guess this is a question I always love to ask is, if clinics are just beginning using evidence-based interventions and they're just kind of on, I don't know, I don't know if I have time to do this. I don't know, I have to figure out priorities. What would you say to those types of clinics?
I would think best start somewhere. Starting is the most important part, because even if you only screen a few people with the beginning efforts, that's a few patients that weren't getting screened before, and that's increasing the ability to catch those cancers early on and extend their life expectancy and their quality of life, and try to make it fun. Something that we haven't mentioned, I'm kind of surprised it hasn't came up. We actually have a golden path trophy with a golden speculum on the top of it. And so we've made competitions within the clinic on which teams can do the most PAPs each month, and then the trophy can float around. We just spray painted it gold. And so just doing some of the things that will raise awareness and get the teams or staff members talking, it really helps with promoting it and getting the excitement going.
I have to ask, with some of the ways that you all smiled, did any of you get the trophies?
I think my team has it right now, so go blue team.
Yes, so I'm going to pretty much piggyback off of what Jessica said. We also had a contest as well. And we did a bra decorating contest, and it was a huge turnout for the amount of participants that did that. And then of course, the one team that completed the most mammograms in that month of October, they received the decorated bra as a prize. So it did get really interesting, but it was a lot of fun just to do something totally different with the clinic. We also did a conjunction to that, a door decorating contest. That way, when the patients are walking by, they will see that and they'll think, oh, okay, you know what? I need to get scheduled for my mammogram. So, that's really, something fun, different, and to spark interest. And yeah, it was a lot of fun.
Yeah, and for CRC, we went ahead and got a spin wheel to do some prizes for the patients, and it was fun to let some of the staff members get that going, and so they had fun helping the patients spin the wheel for prizes, and they got little goodie bags with educational resources and things. So for the patients who were in the age range that they should be screened, 45 to 75, they got to spin the wheel. And so I think both staff and patients had fun with that.
I just want to point out that these are amazing ways to really implement evidence-based intervention in a cultural way too, because I think that can be hard sometimes, right? To figure out what that can look like, because there isn't as much evidence out there. So I think you guys have put a really nice spin on that. Pun intended, Madison. But, as I'm thinking about this, you guys were doing provider assessment feedback, but in a really fun way, so it's just a really great example for other clinics that you can do this, but have it be a competition still. And it can be something fun and invested, the clinics can get really into it. Katie the bra, I think that's really cute. The PAP award, I love the spin the wheel. I think those are all really fun things. They get people thinking, hey, I should probably talk to my provider about that, or providers are like, hey, this person fits in this age range. Let's do this because I want to win that, I want that, award. So I just want to point that out there, that I think it was really genius the way you guys went about this. And I just always loved hearing some of the different updates you had each month, and you always were coming up with great ideas. And what's really beautiful about this partnership is that you would share with us we could share with CDC, but we could also share with our other partners and vice versa. And so I thought it was a really interesting partnership that we had. And I'm just really grateful for some of these amazing ideas you guys have come up with and shared. I'll just ask one more question and then I can pass it off to Misha and Keiki again. But what would you say to clinics, what would you say to clinics that are on the fence with working with AICAF, whether it be, with our screening program, whether it be with our evidence-based program? What would you say to them? What was a highlight of working with AICAF?
We're all in a room together, so it's kind of hard deciding who's gonna go. But like I said, the amount of resources that you've provided, support, brainstorming, I could go on and on. We couldn't have done all of this without you guys, because one person can come up with an idea, but a team of people, is almost always better. So thanks for being on our team. And I would tell them to partner with you guys because it's been an amazing experience.
Sorry, we're seeing who's taking off mute and who's muting their computers. Yeah, it's been an amazing partnership. I attended the Sunset, I think, was it the Sunset convention? I think it was like 5 years ago. So it's come a long way since then. I didn't even know what I was getting into when I attended that. But I've learned so much, and I would encourage any clinic or organization to work with you guys. It's been a great learning opportunity and learning how to incorporate the resources and advance our resources and advance what we're doing. So it's been great. I would highly encourage it.
All right. And then, of course, I would, go off of what they said. The networking has been wonderful, providing that insight, educational feedback, so forth. It's been greatly appreciated. Again, the resources and just, the collaboration with all of us as a team. I think that's very important. And it has opened my eyes in many different other ways and learning the different things that are available out here for resources for our clinic and so forth. So I do greatly appreciate the partnership.
Well, very much likewise. I know our team here would always get really excited to say, oh, do you know what Oklahoma is doing lately? Or like this idea, that idea. Yes, so it definitely is bi-directional with the partnership. And we are just as excited about having the opportunity to work with all of you and to work with so many of you. I think what's really unique about our partnership is that you had a focus for breast, cervical, and colorectal cancer. And that just really demonstrates the commitment to the community that you have, as well as to what it looks like when you actually have the resources, the technical assistance, all of that to make a project really flourish. So very excited about that. So this question is kind of related to some of the work that we've been able to do together. And you kind of probably touched on some of these points already, but just to drive it home, what are some of your proudest accomplishments in working with AICAF on cancer prevention and screening?
I would say mine is just encouraging those patients and providing them with everything they need to, make that decision to get screened, especially those who do end up having a diagnosis, and we can intervene earlier and improve outcomes.
I think mine's kind of going to mirror what Madison said, with having the knowledge and the materials to promote the screening and get patients in for screening. so that we can identify those cancers early on and get them the care that they need. I know I've only been in the cervical screening program for about 1.5 years, and just in that time frame, I know we've caught several that had cancer. And so knowing that the work that we're doing and what we're learning and advocating for is paying off by saving lives. So I think that that's always gonna be what is best, is that we're able to make that impact that we're trying to make.
Yes. Sorry. Oh, there we go. Okay, sorry guys. Yes, again, piggybacking off of Jessica, it's very paramount to get those cancer screenings as soon as possible. And with the partnership and the collaboration with you all, that helps us in the strides to improve those screenings and those rates, and to be able to, again, I keep saying, but provide those materials, because there is just so much to learn. There is just so many cancers out here. And of course, I'm proud at our clinic that we've came a long ways. Before we had the mobile van here for our mammograms, now we have on-site 3D mammography. And it just makes it more accessible for the patients. So any way that we can make things more accessible, provide those educations, it's a huge impact. So, yeah.
I'm so grateful for all the work that you are doing for the community and bringing those creative ideas to the table. But I think it's always not a smooth process while we're serving our community. There are some hiccups and bumps that we always come across, and the major one in the past 2 years was COVID. So what would you guys would like to tell us and our audiences about that, your experiences, and how your ways towards screening and creating that awareness for the community changed in these 2 years?
Okay. So I wasn't really part of this, so I'm not going to take all the credit for it. But during COVID, they used the COVID vaccine events to basically push information and education onto patients for CRC screening, and got people screened even though they weren't coming for a big event. It was just vaccines. So I thought that was really cool, but I won't take the credit for that one. But that's what comes to mind for me.
And we really, for cervical cancer screening, we really had to refocus on the patients that were the highest risk and that had those abnormal paps or were having symptoms. And so that was hard to really just prioritize who needed it the most. Of course, we wouldn't turn anyone away, but our appointments were so limited. We rotated staff members home and only had so many providers on site each week, and the women's health providers were really doing a lot of our OB care and not so much regular screenings. So it did take away from our PAP numbers, but luckily we had promoted screening so much in the years prior that it really didn't decrease our screening numbers overall. That stayed pretty consistent despite not having PAPs really readily available. So we did continue getting our high-risk patients screened that had a history of abnormals, but we did have to shift to prioritize those patients first.
Yes. So initially, I took over Jessica's role with the CRC. And so I went off of some of the ideas that she had. She would have the kits passed out in pharmacy for the CRC kits. And so that would help with also cancer prevention. And then with On Saturdays, there would be the immunization event. We had a drive-through event. So I went off of that idea and I passed out kits to the patients, and that turned out to be a really good turnout rate. And then when I took over in May of last year with the mammograms, of course, I don't know, from what I understand, our rates were a lot significantly less due to COVID. So with that, we had a shutdown from our mammogram department to maybe seeing maybe 5 a day, if that even. Maybe, you know, it was very limited. And so once we started opening, we started spacing those appointments out, and then we gradually implemented more and more patients in, and we are doing still, you know, significantly better than that initially, but I'm really wanting to ramp it up a lot higher than what it has been. So, but yes, we've been trying to do what we can, implementing and advertising that, you know, we do have the on-site 3D mammography. They're not having to get on the crowded mobile van. The appointments are not going to be all in one day. It's going to be spaced out. So that way it provides more comfort to the patient to let them know you know, it's safe to come in. We also still have our protocols as well with the clinic. So that way they also feel secure when coming into their appointment.
A follow-up question to what you guys are talking about with COVID-19, and knowing that, you know, screening was paused, or, you know, there wasn't as much screening done. You know, as we think about that, we think about cancer, you know, rates going up. And so how, you kind of talked about this, Katie, how has it motivated you for outreach? Has that changed? What in addition are you doing? And you guys talked about, you know, fit tests in the pharmacy, or even doing some of those piggybacking like a flu fit, but it was a COVID and fit event. Are there other ways that, you know, you're planning on doing some more outreach, you know, as the COVID regulations kind of lift? You know, what does that look like? More events? What are those different things you guys have been discussing?
Yeah, another thing that I missed earlier was that we were doing mail outfit kits and providing the postage on those. So really all the patients had to do was do the test and send it back. And it was paid for. They just had to write their name. So that was one of the big things as well. So yeah.
So for me, I think just really heavily relying on the reminder postcards has been huge. And also something that I had noticed and kind of tried to make some changes to, our website didn't previously have any information about our women's health programs. And so I had pictures of our providers added onto that, along with what they were able to do skill-wise and taking care of patients, so that if someone was looking at our website and seeing what we had available, they could see our providers' pictures in our women's health care program and see like a little bit of information about them and what services are offered, just to try to make it a little bit more friendly for our younger generations that are using websites and social media and trying to see who they want to see. We did that as well when we had our new women's healthcare provider start. We did a Facebook post kind of introducing her, and I want to say it got like 100 likes or something. It was very popular. And so really getting the word out of these are our providers, this is their information, and trying to make it where it's not just like someone that you come in and see, but really someone that you form a relationship with.
Yes, and then in regards to me with outreach, again, I'm going to be, once these get completed, I'm going to be sending out these postcards that does advertise that we do have on-site mammography, because there's a lot of patients So in summary, when we did get our 3D mammography, that was closer to the end of 2019, and then the pandemic, was here. So there's a lot of our patients that don't know that we have on-site mammography. So with getting this visual aid out there, that will definitely help. That's a great outreach. And then in conjunction to that, I'm working in partnership with our community development department and also our maintenance. And next, actually this Saturday, they're going to, at our 309 building, paint the speed bumps pink. And so whenever the patient goes through, I'm going to have a sign that's going to be made that says, you feel that bump, but and it's going to be a mammogram reminder. So that's going to be another outreach tool that I'm currently working on right now. And I'm very excited about that. Very excited that that got approved. So, but yes, so, and then with, we had our EHR issue, but in March, I was helping out with our CRC portion with Madison and passing out kits in conjunction to their mammogram. And so, of course, that did get put on a temporary hold, but starting in July, I'm going to just go over that again and take place of that, since I didn't get to meet, passing out all those kits in summary, like I planned to initially. So that's some of the outreach that I'm looking into. And then let me grab this. I'm so sorry, I thought I had it. And then I'm going to be placing these up in the clinic, which is kind of hard to see. But essentially, whenever the door is closed and the patient is waiting for their provider, it says, don't be a statistic, ask your nurse how to complete a screening today or call to get scheduled. And it does also have the QR code on it, which is the cancer.org. So it does talk about not only cervical cancer, colorectal cancer, or breast cancer, but it also has those other cancers that patients, can tend to forget about as well. So we are all in a group effort here.
I just want to applaud you all for your creativity and just innovativeness with these projects. That is just, I feel like that's really brilliant and not something that we think about very often. What I think is really unique about, I'm not going to say this right, but I think the Fill Your Bump essentially is that it's also speaking to the actual physical environment that we know our relatives are in, which is really beautiful to kind of acknowledge the relationship that we have to the land, that we have to our actual physical space, which is a way that we can also maybe even acknowledge how we show up and how we are embodied or maybe not embodied in our actual physical form, so that's really, really beautiful. And there's a deep spirituality, I think, in that, as well as just a cheekiness, which is really, really fun. And I really appreciate that about your team as well, because it makes life playful. And we know that our relatives love humor and love thinking about life in very creative, different ways. So that's really beautiful and fun.
Thank you.
Yeah. I'm going to pivot this, and it's going to probably get a little bit serious. But I do want to ask a little bit about your experience as a team in the pandemic, specifically as frontline workers. A question that we often have at AICAF is around how our urban Indian health programs have these really amazing teams and are ready and motivated to do the work, but they often just need more resources, more capacity to be able to do that. Why I'm saying that is just to acknowledge that the pandemic even placed an even higher burden or challenge to that situation. And so knowing that maybe some of you or just other frontline workers, clinic staff are really affected, there have been a lot of challenges or maybe opportunities to staffing, specifically staffing turnaround and retainment. So what conversations has your team had, or maybe changes that your team has made for clinic staff around the pandemic and some of this challenge opportunity moment.
Yeah, I think Jessica kind of alluded to this earlier, but having those nurses rotating home and having to pivot a little bit to where we were giving out the fit kits via mail rather than in clinic, and just always evolving to meet our patients' needs, because it is just always changing, especially with COVID, and just trying to find ways to get these patients screened.
I think the pandemic has helped us, the nursing department, work closer together. It was really challenging, but I do think it made us stronger. Not that any of us wanted to be that strong, but it did, I think, make us stronger. I feel like, have been through a lot of challenges since the pandemic. We've had some EHR issues, we've had internet issues, phone issues, AC issues, just kind of whatever things want to get thrown at us. And our department just like evolves and we continue to go. And so I think it really did help us kind of plan for those like emergencies or those hiccups that are going to inevitably come up. And we just kind of work together and shift and continue to move forward. So I've been very lucky to have the team that I do, but AICAF has also been super understanding when we couldn't get the data we needed or we couldn't get on meetings because we didn't have a staff to be able to cover us and so forth. So yeah, I think it's made our team a lot stronger.
Yes, we definitely had to utilize a lot of contingency plans. But, you know, as they say, what doesn't kill you, it makes you stronger. And we definitely have had the strength and, you know, the resilience overall. We've powered through. We've tried to reach out to those patients as much as we can. We tried to get them in the clinic. And I found it really interesting. I thought it was really neat whenever I was formerly doing CRC and Jessica was over it, that she come up with these masks that says cancer doesn't quarantine. And that could not be better said. But with the partnership with you all, it's greatly been appreciated, and all of the insight and other resources and the help that you all were willing to provide to us, and of course the understanding through all of our trials and tribulations over here at the clinic. And we do greatly appreciate you all working with us.
Well, I just want to say thank you all for what you've shared today. I think there are so many wonderful nuggets of information you have shared with the audience, and I'm sure they've taken a lot of that to heart and are going to hopefully implement some of that in their communities. So I want to give the audience, Misha, Keiki, and I want to give the audience some time to interact with you. You know, we all come from different backgrounds and have found different solutions to working with our communities and what makes sense for screening initiatives. So, you know, I want to leave it open to the audience for, you know, a couple moments here to see if they have any questions for you. I know we hadn't done that with housekeeping earlier, so I just want to give a moment of time, silence, to see if we get any questions. There have been some great commentary on our Facebook live stream, so I want to let you guys know that there's been a lot of people just saying, yes, that's so important to get resources out there. You know, it's really important to have these conversations. And so letting you guys know that there is some really excellent commentary on Facebook right now. So I will be silent for just a moment here to see if we have any questions. And if not, we can go into the honoring ceremony.
Well, it doesn't look like we have any questions yet, but maybe we will. So in the meantime, maybe just to kind of wrap the interview portion up, is there anything else that you want to share? Is there anything, I guess, that you could answer maybe one of our last questions or elaborate on? What are some of your cancer prevention and screening plans for the future? I mean, I know you've mentioned a lot of it already, so if there's anything else that you want to add, and or just anything that you want to share specifically about cancer screening, survivorship, any parts of the cancer continuum.
So essentially, we're gonna still utilize small media, but we're going to, in the future, start placing it on our TVs out in the lobby. That way it will remind, like a general reminder system as well. So when the patients are also waiting in the lobby, they'll have those educational resources in opposed to just watching TV or whatnot. And hopefully that will educate them and the elders as well.
I think just continuing to find ways and look at ideas on how we can make it fun and promote the screening is important, because like I mentioned earlier, even if we only get a few more people screened, it might be the people that are needing it, and that we can get in for treatment and get taken care of before it's too late to get treated. So just continuing to work towards any kind of screening efforts, and every individual that is screened is one more that we potentially caught early.
Well, thank you. Your insight is so informative and helpful to understanding the impact of cancer and how it affects families in our community. AICAF considers your work very fundamental to our organization. So on behalf of our AICAF team, I would like to present to you the plaque and the blanket, which is a little bit interesting to do virtually. So I don't know if you have it with you, but feel free to hold it up or something if you would like to. Otherwise, in recognition of your dedicated service in promoting cancer prevention in our communities, just thank you so much, Chi-Miigwech, for your sacred advocacy and work.
Beautiful. Thank you so much for sharing. That's amazing. So now comes the time we would love to introduce our honor song. We're pleased to welcome Junior Johnson, who will now share an honor song for our clinics and the amazing work they have done. So Junior, I'm going to pass it over to you.
Well, I just want to say thank you for inviting me to sing.
Oh, thank you so much, Junior. That was beautiful and we really appreciate it. Thank you.
Yep.
Thank you to Junior Johnson for the honor song and AICAF staff for your assistance in this virtual honoring event. Thank you to all of our relatives who are in this circle with us as we celebrate and honor our partnering clinics. Again, the American Indian Cancer Foundation thanks you deeply for your contributions to cancer prevention and health advocacy. Blessings to all of you on your journeys. We look forward to talking with you all soon.
Thank you.
Thank you.
I thank you guys.